cardiac cycle. What is meant by cardiac cycle? It is one of the mechanical event which is happening in the heart. In the heart, we have electrical event, mechanical events like that. So in that, the first thing which we have to see and understand is the mechanical events of the heart. So that is the cardiac cycle. When you want to define cardiac cycle, it is the sequence of events which occurs from the beginning of one atrial systole to the next atrial systole. That is the definition of cardiac cycle. So cardiac cycle, as the name, we are going to see the cyclical flow of blood in the chambers of the heart. Okay, in simple, what we have seen, the upper chambers is getting the blood from the systemic venous, that is superior and inferior vena cava, and the pulmonary vein. From the upper chambers, blood is entering into the lower chambers, and there is a valve control mechanism called AV valve, and from the ventricles, lower chambers, it is again going to the pulmonary circulation, systemic circulation. Again, from the pulmonary circulation, it is going to enter into the upper chamber back. Yes or no? So that cyclic event which is happening, that is, we are calling it as a cardiac cycle. And now we are going to see in detail what is the cyclical events. What are all the events which is taking place in the cardiac cycle? So first in that we will see is atrial systole. What is meant by systole? Contraction. What is meant by diastole? Relaxation. When we talk about cardiovascular system, we will mention the contraction of cardiac muscle as a systole and the relaxation of cardiac muscle as diastole. But when we talk about the skeletal system, we will just mention as contraction of the muscle, relaxation of the muscle. Okay, just the terminology varies depending upon the system what we are studying. Okay, so atrial systole, as the name indicates, it is going to talk about the contraction of the atrium. They are the upper chambers. Okay, in atrial systole, we don't have any other subdivisions. Just only remember the duration of atrial systole is only 0.11 seconds. Okay, so the duration is only 0.11 second. Within that small period of duration, the cardiac atrial systole is going to happen. Okay, so again you need to draw the heart. Okay, and now we are going to talk only about the atrium, so we will bother the structures in the atrium alone. Okay, clear? So it is getting the continuous inflow of blood from the superior and inferior vena cava, and same thing with the left side through the pulmonary vein. From where the pulmonary vein is bringing the blood? From the lungs. Okay, it is dealing with the oxygenated blood, but it is dealing with the deoxygenated blood. Okay, clear? So now there is continuous inflow of blood into the upper chambers. In both the sides, because of the absence of valvular mechanisms in the superior vena cava, inferior vena cava, and the pulmonary vein. So there is always continuous entry of blood into the atrial chambers. Once when the chamber is filled with fluid, what will be the pressure? Pressure is high. Always remember, when the space is empty, if there is nothing inside the space, you will have a negative pressure. Okay, but if it is filled with something, that is generating a positive pressure. Okay, and here we are going to see the events in the cardiac cycle where the substance what we are mentioning here is the blood. Okay, we are going to see blood movement in different layers and how it is moving. And all the cases, the blood is going to move from higher concentration to the lower concentration zone. Okay, there is no reversal mechanism as like what we have seen in the osmosis, cell transport. No, nothing is going to happen over here. Always the blood is going to move inside the cardiac chambers by the higher flow to the high concentration to the low concentration zone. Remember this concept always throughout the cardiac cycle. Okay, so first, from the superior and inferior vena cava, we are getting the blood. And why the blood is entering into the atrium from the venous system? Because of the higher concentration area. So here, before the blood enters, this space is empty. So now, empty space, low pressure. This low pressure makes the substance attracted. When the space is empty, it means low pressure, and it will also have negativity because of the empty space. Hollow space will always have the attraction force. Okay, so this makes the blood to move from the superior and inferior vena cava, which is getting the continuous blood from the brain, and this is from the whole body. The inferior vena cava is getting. So the venous return, this is what is the venous return. The venous system is bringing all the blood back to the heart for purification purpose. So this is exerting a pressure which is higher than that of the atrial pressure before the atrium gets filled with the heart. And this difference in the pressure will be always maintained. That is why there is continuous venous return in our body. From the upper parts of the body, the superior vena cava is bringing the venous blood. And from the lowest part of the body, the inferior vena cava is bringing the venous drainage. So everything is going into the heart. The venous blood is now going to transform into arterial blood by deoxygenation converted into oxygenation. So this is exerting a pressure over here. So the venous pressure is higher than that of the atrial pressure, that makes the blood to enter into the atrium. Okay, clear? So now empty space is filled with the blood. So it makes the low pressure is slowly becoming high pressure. When the blood is continuously filling in the ventricles, the pressure in the atrium, the pressure in the atrium is increased gradually. Yes, clear? And now compare between the upper and the lower chambers. Okay, so now which is the high pressure zone between the upper and the lower chambers? Upper chambers are in the high pressure zone, where the lower chambers are in the low pressure zone. Why? There is nothing in the ventricles. Ventricles is not having blood. So what happens? This AV valve, initially before the opening of the valve, you will have the bulging of AV valve towards the ventricles. This is because of the atrial systole is going to happen. Okay, and now followed by the atrial systole. Next, the valve is now opened. The AV valve is finally opened because of the high pressure in the atrium. Okay, immediately once when the valve opens, this upper chamber is filled with high concentration of blood, but the lower chambers there is no volume of blood. So this is the low pressure zone and it is empty before the valve opens. In the sense it also have some negativity. So immediately once when the valve opens, what happens? The blood which is present, which is pooled in the upper chambers will come and hit the walls of the ventricles. Yes or no? So it will come and hit the walls of the ventricles, and that you call it as ventricular filling. Okay, clear? So the ventricles is completely filled. Okay, and there is also the subdivisions in ventricular filling. We will see that after the ventricular systole. Okay, so now the ventricular systole, it is having further subdivisions. The ventricular, in atrial systole, we don't have any other subdivisions. The atrium is contracting on the whole and bringing the blood from upper to the lower chambers. Now the ventricles is filled with the blood. Okay, now after that the ventricular systole is going to happen. The ventricular systole in the sense it is the contraction in the ventricles. Okay, in that you have further subdivisions as isovolumetric contraction and ejection phase. And this ejection phase includes rapid ejection phase, then reduced or slow ejection phase. Okay, so these events we are going to discuss now in the ventricular systole. So overall ventricular systole is contraction of the ventricles. When the ventricles contracts, the blood is going to the systemic and pulmonary circulation. And before the contraction of the ventricles, this is going to give the blood supply to the major supply, pulmonary and systemic. So the ventricles should prepare itself before the blood is ejected out from the ventricles. So that is called as isovolumetric contraction phase. As the name isovolumetric contraction, it means there is no change in the volume of the chamber. Iso means same. Volume is the size of the chamber. There is no contraction, there is no relaxation. Ventricle is completely filled with the blood. The ventricle is now a, see remember, after the blood entered from the atrium to the ventricles now become a high pressure zone at the end of atrial systole. Okay, the blood moved from the high pressure to the low pressure zone. Then the ventricles now became a high pressure zone when compared to the atrium. So this AV valve will be closed. So atrial systole we have done, and now we will talk about the ventricular systole. Okay, there is still blood in the atrium, but it is in the filling phase. So now the atrium is low pressure zone, but whatever blood which is present in the atrium, it has moved to the ventricles and makes the ventricles high pressure zone compared to the atrium, which is becoming a low pressure zone. What made the AV valves to open? The pressure in the atrium made the AV valves to open to bring the blood from upper chambers to the lower chambers. And now the reverse has happened with the pressure between the upper and the lower chambers. So this AV valve is closed. Okay, and from the ventricles you have the valve which is also closed. Now the ventricles is a completely closed chamber, fully filled with the blood. How will be the pressure inside the ventricles? High. A closed chamber, completely filled with the substance, the blood. It is a high pressure zone. So this is the initial beginning of the ventricular systole. Okay, so what is happening here? There is no change in the volume of the ventricles. Just it is filled with the blood. But since AV valve is closed, semilunar valve is closed, now the ventricle is increasing its pressure inside. Enormous increase in the pressure of the inner side of the ventricle is taking place. So this phase is called as isovolumetric contraction phase. Clear? So this increase in the pressure of the ventricles during the isovolumetric contraction phase makes the semilunar valves to open. So what is happening over here is the semilunar valve is opened. So once when the semilunar valve is opened, the beginning of ventricular systole occurred. So what happens? The walls of the ventricles now contracts. That is ventricular systole. So once when the walls of the ventricles contracted, then immediately the blood will rush to the pulmonary artery and the aorta. So this empties the ventricles. At the immediate opening phase, there will be enormous increase during isovolumetric contraction phase. So once when the valve is opened, at the end of isovolumetric contraction, the semilunar valve is opened. So this gives a rapid ejection because the closed isovolumetric contraction phase has built a higher pressure in the ventricles, and this makes the blood to eject from the ventricles rapidly. That is called as rapid ejection phase. Followed by once when the blood has started moving out from the ventricles, the pressure slowly starts decreasing. So the ejection force also gets decreased, but still it will eject. But the force gets decreased. Why? Because once when the blood starts entering into the systemic circulation and the pulmonary circulation, and now the ventricles is becoming empty. The blood is only present in the pulmonary circulation, systemic circulation. There is very less amount of blood in the ventricles. So now this became the high pressure zone and ventricles became the low pressure zone. Immediately what will happen is the closure of semilunar valve occurs to prevent the backward flow of the blood into the ventricles from systemic and pulmonary arteries. This makes the semilunar valves to close. Okay, clear? So this is the end of ventricular systole, not the end of cardiac cycle. Still you have. Okay, so this is the end of ventricular systole. So see the condition of the ventricles now. Still the AV valve is closed. Again, semilunar valve is closed. Again, the ventricles is now becoming a closed chamber. but it is not having full amount of blood. Ventricles is a closed chamber which is not having blood. Okay, so now the ventricles is in the contracted state. So what should happen next? What is the event which is required to happen next? During this ventricular systole period, what is the event which occurred in the meantime in the atrium? Since the ventricular systole is giving the blood out to the systemic circulation, we will consider the ejection fraction over there. We will consider the cardiac output. This cardiac output is going to determine the blood pressure, which is going to maintain the mean arterial pressure, which is the most important factor to supply blood to all the vital organs in our body. Since this ventricular systole is related with all these important factors, the same time when the ventricular systole is happening, the atrium is filled with the blood, where the atrial diastole is taking place, but we are not giving much importance in the phases of cardiac cycle because it is happening at the same time. There is no any valvular mechanism, so there is no any major concepts which is required to explain this atrial diastole. At the same time, ventricular systole is taking place, which is having a great importance in the cardiovascular system. We are talking in detail about this ventricular systole. So at the end of ventricular systole, the atrium is filled with blood and the ventricles is almost empty state. There will be always some residual volume of the blood. Okay, but we will not consider that in the top. Okay, so almost the ventricles is now considered as a empty chamber. Again, it is a closed chamber. AV valve is closed, semilunar valve is closed, but it is not having anything. But in case of isovolumetric contraction of the ventricular systole, we also saw such similar condition of closed chamber of the ventricle. But it is fully filled with blood. But here it is empty. So that makes us to talk about ventricular diastole. Okay. So in the ventricular diastole also, we have further subtypes as, first one is protodiastolic period, and second one is isovolumetric. What phase will happen over here? Relaxation phase. Then rapid ejection phase, or what is happening here? Ventricular diastole, filling phase. Then finally slow filling phase, also called as diastasis. Okay, clear? So this protodiastolic period, it is the period where the ventricles is closing its semilunar valves to prevent the backflow of blood into the ventricles from the pulmonary artery and the aorta. So now the protodiastolic period is it's not audible. Clear? So now the protodiastolic period is making the ventricles, the semilunar valves to close to prevent the backflow of blood from the pulmonary artery into the ventricles, from the aorta into the ventricles. So that made the isovolumetric relaxation phase. Again, the term isovolumetric. In contraction phase also we have seen isovolumetric contraction phase. Here the ventricles is again a closed chamber, but it is empty. Empty space, closed space. What kind of pressure is building up over here? Negative pressure or a low pressure. So it brings the negative pressure because of the empty closed space. Okay, so this negative pressure always have the attraction force. Okay, so it will try to attract the substances towards it because it is having the negative pressure. The negative pressure will have a suction force. So this is the pressure, the very low pressure which is maintained in the isovolumetric relaxation phase. Okay, there is no change in the volume of the ventricles, but it is a closed space, empty space, which is building the negative pressure or the low pressure, which is going to exert a suction force, and followed by this isovolumetric relaxation phase. Since the pressure is started building up very low over here, what will happen is this makes the AV valves to open. So the AV valve is opening over here in both the sides. Opening of AV valves. See, remember, hollow space, empty space, having the suction force, and a very small opening is happening initially. What will happen? It will attract the substance which is on the other side. So here, during the meantime of ventricular systole, we have seen the atrium is filled with the blood, and now the valve is opened. So what will happen? Initially what will happen is the valve will open very small, and later on the valvular opening will become big. That is how the valve will open. If you are opening the door of a room, immediately once when you hold the lock system, you will not open. Slowly you will turn. Okay, so when you are about to open the room door, slowly you will open. Yes or no? Same like that. Here, the valvular mechanism, if the opening is happening in a very small manner, then bigger, then the bigger. So initially with the small space, there is rushing of blood because of the small opening, and the pressure build up in the higher chamber is more, and then the pressure in the lower chamber ventricle is very less, which is exerting a suction force. So what will happen is this makes the blood to come and hit the wall of the ventricles, and that hitting of blood during the ventricular diastole is going to produce a sound. We will see what sound is that during heart sounds. Okay, so there is a presence of sound once when the wall opens and the blood come and hits the opposite side of the ventricular wall. Because of the force, it is generating a sound that is called as one of the heart sound, that is we will mention as S3 mostly. Okay, about S1, S2 we will see later. Okay, clear? So that is what is called as rapid filling phase, followed by the rapid filling phase. So blood started filling the ventricles, and now the low pressure in the ventricles slowly becomes high pressure because the negativity is lost due to the entry of blood into the ventricles. So it also reduces the force of movement of blood from the atrium to the ventricles. So that is followed by slow filling phase. Okay, clear? So This slow filling phase in the ventricular diastole requires one more mechanism to happen. When the blood is moving from upper chamber to the lower chamber, atrium has to contract. Yes or no? The atrium has to do the contraction. Then only the entire amount of blood in the atrium will enter into the ventricles. So there you talk about the atrial systole. Again, the beginning of cardiac cycle. What we have seen over here. Yes or no? This is how the cyclical events occurs in the cardiac cycle. Okay, clear? So what are all the events we have seen? Atrial systole, ventricular diastole, ventricular systole. Okay, so that now you just read the definition of the cardiac cycle. It is the sequence of events from the beginning of one atrial systole to the beginning of next atrial systole. Now you understood the definition of cardiac cycle, how the beginning of one atrial systole to the next atrial systole gives the cardiac cycle. So all the definitions very difficult to remember if you don't understand the concept. So if you understand the concept, you can give the definitions in a simpler way. Okay. So clear with the cardiac cycle? Yes. So now what is the output given from the cardiac cycle? What is the end of cardiac cycle? It is atrial systole. Again the cardiac cycle will be in a cyclic way. So finally now the venous blood is going to the pulmonary circulation and systemic circulation. Yes. So now this systemic circulation we are going to consider in the form of cardiac output.